this week on our condition of the week, we're going to discuss knee pain. So there's 4 major ligaments that help kind of stabilize and support the knee. I'm not going to bore you and go over all those names. Now, what we're going to really focus on today is the 2 lateral ligaments that kind of are located kind of on the medial and the lateral side, or the outsides of the knee. Now, those 2 ligaments are very important to kind of make sure that the knee kind of stays stable. And when we talk about valgus and varus stresses of the knee, we talk about, in comparison to the femur and the knee itself, how is the lower leg? Is it shifting left or right, or is it going more laterally or medially? And that's where you're going to get your valgus and varus stresses. So of the 2 ligaments, the LCL and the MCL, I would just kind of consider those kind of the short terms for those. The most common is a MCL injury, which is going to be on the inside or the medial side of the knee. Now, how we typically get that is going to be a blow from like the outside. So it's very common in football, soccer, basketball. It's just if someone like happens to land on the outside of the knee, it's going to create a valgus stress, which is where the lower leg in comparison to the knee and the femur will shift kind of outward. So it would kind of do this number. Now, what we're going to see there is just a lot of pain and discomfort right here on the medial aspect of the knee. So when we kind of discuss MCL injuries, we're really kind of grading them from grade 1 to grade 3. Now, grade 1 is just kind of like a small injury. It's just you kind of stress the tissue but don't necessarily tear anything. Where grade 2 starts to kind of move more into, you could potentially tear something, maybe not a full tear, but you do have some form of a torn ligament. And then grade 3 is a full tear. Now, typically in an MCL injury, if it's a grade 2 or higher, you may see some form of other injury to the knee. So you may see some of the other ligaments that might be kind of injured, or you might have a meniscus kind of irritated as well. So typically anything past like a grade 2 and up, you may see kind of more of a complication of the knee because of the stress and the amount of force that's being put into that knee itself as well. All right, so typically a patient's going to come into our office with something like this. Majority of the time it's going to be after a sports injury. You know, it's very common in our office this year specifically. We've seen a lot of soccer injuries that kind of occurred to this MCL. We've actually had a couple of football injuries already come into the office for this, where, like I mentioned earlier, you just kind of get hit on the outside of the knee and it just kind of stresses that knee in a manner where it's going to start to injure that MCL ligament. Now, a patient may complain of, difficulty walking. They may kind of be favoring the knee because there's sometimes that force of movement is going to kind of irritate that tissue. Like that ligament is there to stabilize the knee. So if you do injure that ligament, you're going to see maybe you see a little bit of laxity in the knee. The patient may kind of tell us, hey, we don't really feel like we're very stable in this area. So on top of that, typically when we get into the examination, we're palpating, we're kind of feeling the area. Most of the time an injury to this ligament is going to be just kind of local to the area. You're not going to see a whole lot of radiating pain. Like I said, you also might see a little bit of swelling. If the injury's severe enough, the body is going to send fluid to the area and you're going to get that swelling. Maybe some irritation, maybe some redness, as well as maybe a little bit of like heat associated with it. So that's kind of something that we would see in the office if they came in with this injury.
Mm-hmm.
So let's get into the meat and the potatoes of this. How do we fix this? How do we manage this as a conservative practitioner? What are we going to do that's not going to require cutting, anything like that? So typically a rehab protocol for this injury would require 3 phases, where phase 1 is just kind of the gentle, getting you back into normal walking patterns, just doing easy, light stuff that kind of just teach the body that, hey, we need to start utilizing this muscle or this ligament a little bit more. We need to kind of start working on stability again, where we're also not putting any kind of stress on the tissue, because that's the big thing here is we got to make sure that we're not pushing the ligament too hard, too fast, or else we're going to be at risk of a re-irritation. Now, as we pass grade 1, where the patient can kind of walk freely without a whole lot of pain, they're starting to kind of get their range of motion back when they move the knee. Typically, phase 2 is kind of just upping the rehab. We're just kind of putting a little bit more stress on the tissue, just kind of making it work a little harder. Because again, like I said, we're just slowly easing force onto that tissue to kind of make it heal faster, as well as make it heal stronger. And then we get into phase 3, which is where we start to kind of work in our strengthening exercises. So we're going to start a whole lot of work on the quads, on the hamstrings, work a little bit on the calf as well, because now we need to start strengthening the muscle tissue around the knee. That's going to kind of facilitate that stabilization into that knee itself. So on top of the rehab protocol that we'll put the patient through, we also like to do some soft tissue work in the area. So we're going to do a little bit of instrument-assisted soft tissue manipulation. We're going to also do a little bit of cupping, maybe, as well as we do have the capability to do dry needling that will also facilitate that healing process. So last but not least, if the injury is severe enough, we will tend to kind of recommend a bracing. Especially if we suspect there's multiple structures being affected in this injury. If it's a grade 2, one of those lateral collateral ligaments, if it's a grade 2 or higher, we may have to get some imaging to take a look and just kind of see if all the other tissue looks good. So in that case, a brace might be useful just to kind of give you some short-term relief and some short-term stability. But we're going to try our best to get you into, stabilization exercises as fast as possible, because that's where we're going to really start to see that repair and that healing occur from the body. So if you've taken a slide hit to the lateral leg and it's affected your knee, we'd love to help. We'd love to kind of show you how we get this better. We want to show you how we manage it and kind of speed up that process, and we'll kind of get you back on the field as soon as possible. So give our office a call at 513-463-3011, or you can schedule online, and we'll be happy to help. See you soon.